As a healthcare provider, there are many times when I am choosing not to use cupping therapy. There are certain symptoms and conditions where I do not want to use it because it'll actually do more harm. If you're new here, my name is Dr. Duong and I'm a physical therapist and certified cupping therapist. Now, cupping therapy is one of my favorite tools to use because I've seen it get results time and time again. Now, if you've never heard of cupping therapy, it's essentially a type of massage that uses suction or decompression to separate the layers of muscle, skin, fat, myofascial tissue, all of that to help you feel better, similarly to how massages help you feel better. With the suction, discoloration may come to the surface, but they aren't bruises. It's just cellular debris and toxins coming up, and they clear out within about a week. Cupping therapy has so many benefits and can help many different conditions. Benefits include decreasing muscle tension, improving blood circulation, stimulating healing, and decreasing stress anxiety. For conditions, it can help with headaches, a lot of bursitis, tendinitis, carpal tunnel syndrome, back pain like sciatica, the list goes on. So we know cupping therapy helps in so many ways, but it's also important to know when you shouldn't use it and when there are certain conditions or symptoms that you want to avoid cupping altogether. This includes if they have broken bones, if they had a recent rupture tear, any acute injuries. So those are injuries within the first couple days of happening or within the week. I choose not to do cupping for them because it'll actually irritate the injury even more. If anyone has recent surgical incisions, again, that skin is super fragile and healing. And if I were to put suction over that surgical incision, then there is a high probability that that skin and the incision is coming loose, and the surgeon will hate me as well as the patient. And trust me, I will hate myself. So no way do I do cupping for people who just had surgery and over those surgical incisions until about 8 weeks out. Sometimes 6 weeks, it just really depends on how the patient's healing, but most of the time I'll play it a little bit more cautious and I'll wait 8 weeks for the proper healing period before I go over any of the incisions with a cup. Additionally, if someone is undergoing cancer treatment or has active cancer, I do not want to do cupping for them because that can spread the cancer to other parts of the body, which we do not want. Of course, there are a ton of other symptoms and conditions where I would not choose cupping therapy for my patients. So make sure you are asking your healthcare provider if it is okay for you to get the session done, because there are a lot of circumstances and it always depends. If you enjoyed this video and learned something from it, hit that like button, hit subscribe, and share it with your family and friends. And that will let me know that you want to see more and want to learn more about other symptoms and conditions where cupping may not be for you. But besides those conditions, remember everyone, cupping is super beneficial, can help so many conditions. So just try it out if you don't have any of the contraindications that I've listed, because trust me, it will change your life. Bye!